Wow, you guys are like really good at like sitting down and being quiet. Thank you. We're going to start the program, and I'd like to bring Dean Vandergens to the podium. Thank you. Good evening, everyone. I'm Jean Vandergens, Dean of the College of the Environment and Life Sciences at the University of Rhode Island, and it is a privilege for me to welcome you to the 2025 Metcalf Institute Annual Public Lecture Series, Equity on the Table, a conversation about public health, food access, and climate change. First, I'd like to thank Farah Warner, Executive Director of the Metcalf Institute, for her leadership and for organizing this important series that connects science, communication, and community. And thank you to the College of Health Sciences and the Harrington School of Communication and Media for co-sponsoring tonight's event. As I provide these remarks, I know I'm preaching to the choir when I say that an event like this has never been more important. We're all witnessing how complex issues like climate change, food insecurity, and public health require decisions that are grounded in rigorous, peer-reviewed science and communicated in ways that build trust and understanding across communities. It's not enough to generate data and knowledge. We must also ensure that discoveries inform policy, legislation, and daily choices in our communities. And that is one of the roles Metcalf plays, bridging scientific insight with public engagement and empowering scientists to connect their work to real world challenges in people's lives. In my first few months at URI, I've met many alumni who remind me why this work matters. One recent graduate shared that after earning an engineering degree from an Ivy League institution, she quickly realized that she could not effectively communicate her work to decision makers outside of her field. She came to URI for a master's in environmental science and management, where she focused on science, communication, and policy, and was actively involved in Metcalf at that time. Through the program, she learned to translate technical findings into language that inspired action. She told me that her career success today and her ability to make a difference stemmed directly from this experience at URI. Her story demonstrates why communication is not an add-on to science. It's fundamental to making science useful as well as equitable. By working with scientists and journalists, fostering trust in science, and engaging communities in evidence-based dialogue, Metcalf is advancing both environmental literacy and social equity. As tonight's conversation reminds us, this is especially important when addressing complex challenges like climate change, food systems, and public health. So as we listen to tonight's distinguished panel, I invite you to think not only about the science itself, but about how we can all be part of communicating it in our classrooms, our communities, and our daily choices. So thank you for joining us, whether in person or online, and thank you for being part of this work to ensure that equity and science remain at the center of the table. So now it's my pleasure to introduce my colleague, Dr. Patrick Vivier, Dean of the College of Health Sciences at URI.
Thank you, Jean, and thanks, Farah. I'm really thrilled that the College of Health Sciences can be part of the evening and helping to support this really important talk. I frequently say that the problems that one discipline can solve by itself have already been solved. We're only left with the ones that really require multiple disciplines, multiple communities coming together as we talk about big things like public health and climate and food access. So really thrilled that we have this incredible panel to really delve into those issues. So want to welcome all of you, and I'm really excited to hear how we do address these really complicated issues and get these things moving along. I'm also really thrilled to be able to introduce Dr. Sunshine Meneses, who was the executive director of Metcalf, who helped co-create the SciComm Identities Project when she was executive director. And so it's really fitting for Sunshine to be able to come up and help us move forward in the rest of the program. So thank you for being here.
Good evening, everyone. Hello, I am so happy to be here and I'm so excited for this conversation. So the SciComm Identities Project, which we refer to as SCIP, was a partnership between originally myself and Bruno Takahashi at Michigan State University, who were the co-PIs of this project, as well as Metcalf Institute, and Jason Japs, who is a professor of journalism and film media here at URI, and the Knight Center for Environmental Journalism at Michigan State. We started SCIP because SciComm training is thankfully increasingly common, but it tends to be done in a one-size-fits-all manner. And the reality is, of course, that scientists who choose to do science communication do not come in one size. We come in many sizes, and we come with many different motivations and many different experiences. So this also coincides with the fact that there is a disproportionate gap in who participates in science communication trainings. So we have a lack of racial and ethnic diversity among the scientists and engineers who participate in this. So the original idea for SCIP was perhaps we could resolve both of these problems, or at least start to address them, if not resolve them, by creating a science communication training curriculum that centers identity and culture and lived experience as the beautiful, brilliant center of science communication. The idea here is that by exploring all of these different perspectives that a person brings to their science communication, we might not only create a more representative group of scientist communicators, but we would also improve science communication in general and make it more appropriate and relevant to a really wide range of audiences. So with that in mind, we had we actually ended up with 2.5 cohorts of this one-year fellowship. It would have been 3 were it not for the grant being terminated earlier this year, because it doesn't align with the Trump administration's ideas. But we had at least 2.5 cohorts of this fellowship, and it has been a really instructive project, and we're learning so much from it, and we look forward to getting all of this out much more broadly so more people can implement this curriculum. With that, I am really excited to welcome Farah Warner, Executive Director of Metcalf Institute, to introduce this panel.
Thank you. Thank you so much, Sunshine. It is a pleasure to be here as I climb up on my stool. I've been looking forward to this conversation for quite a while. As the team was really thinking about what were we going to do for our fall lecture, it occurred to me that we really needed to honor the work of Sunshine's program and Bruno's program and bring back some of our SCIP fellows since they didn't get their July visit to Michigan State. So the other thing that was important is that throughout the SCIP fellowship, each year had a theme. And so when I came in as executive director, I was like, well, we should just match the theme of SCIP to the theme of what Metcalf is going to do. And so this year, Metcalf Institute is focused on the effects of climate on our food systems and the reverse of that, which is also the impact of producing food for billions of people on the face of the earth, which also adds to global warming. So we had this wonderful opportunity in January of this year to engage with the 2025 SciComm Identities Fellows. And we all got together at the Mosby Center and had a really great brainstorm on what would scientists working in this field want journalists to know. And that really guided our annual science immersion workshop for journalists. And so we were able to bring this really vivid and rich immersion to 10 journalists. We bring 10 journalists to Rhode Island every year, 8 from the US and 2 from international locations. And they got to do all kinds of amazing things in terms of food systems. They went to Candace Oviatt's lobster lab, which is so much fun to go to. We went up to Roger Williams' university to their oyster aquaculture, and then we spent time as well at Peckham Farm, where we learned about silvopastures, which are pastures that have nut trees on them, which are far more sustainable for animals, pasture animals as well as wild animals. So this feels like the perfect way to end our 2025 annual lecture series by bringing these Skip Fellows back to campus. So welcome to all of you. Thank you. So on stage today we have Christina Kenga. Dr. Christina Kenga is the Rollins Assistant Professor of Environmental Health at the Rollins School of Public Health at Emory University. She was a Skip Fellow in 2023, the first year. We have Dr. Roger Figueroa, who is the director and founder of the Figueroa Interdisciplinary Group, which is the FIG Lab, and assistant professor in social and behavioral science and nutrition at the Division of Nutritional Sciences, College of Human Ecology at Cornell. He was a Skip Fellow in 2025 and was a part of that really fun visioning session that we had. And then at the end is our very own URI, Dr. Ambaraj Kamalkar, who is an assistant professor in the Department of Geosciences here at URI, and he was a Skip Fellow in 2024. So please help me welcome all of them to the stage, please. So when we got together to talk about this panel, I said I would love it if each of you could describe your research and how it connects to this concept of equity on the table. So Christine, why don't we start with you?
Sure. First of all, thank you for the invitation to be here. I think I speak on behalf of the panel. We're so happy to be back here at URI. I'm an epidemiologist, a chronic disease epidemiologist, and what that means is I study the distribution of disease in a population and also risk factors for a disease. And the risk factors I focus on are environmental risk factors. So the air we breathe, the water we drink, and the food that we eat. And what we know about these risk factors, and here in the U.S., is that for certain populations, there's kind of a differential exposure. So certain populations are more likely to be exposed to the environmental hazards in our environment, and also exposed to some of the benefits of our environment, differentially exposed. And what that means for equity is when we are planning public health interventions, our interventions have to be a little bit more targeted depending on the population we're working with. So that's the role I see of equity in the work that I do.
Great, wonderful. Roger, would you like to tell us what the FIG Lab does and what your area of research is in?
Absolutely. Well, first of all, I just want to thank you for the invitation, being in conversation with all of you. So I am Dr. Roger Figueroa. I'm a faculty at Cornell in the Division of Nutritional Sciences. I study food and nutrition insecurity as a social driver for disparities in chronic illness. We know that food and nutrition insecurity is a problem that has gotten worse since the COVID-19 pandemic. It hasn't improved. And we also know that there is a clear correlation between food insecurity and it worsening with negative health outcomes. And so that correlation is something that I'm worried about because it's disproportionately burdening Black and Brown communities. The way I think about food insecurity is through the 4 pillars, which include food availability, where is food being produced and being distributed so that people can access it. From the accessibility pillar, which is not only being physically able to access foods, but being able to afford the foods. From the food utilization pillar, even if we access and afford the foods, are we consuming foods that are nutritious for us and our health? And can all those 3 pillars and the 4th pillar of food stability be consistent, which means that not only being able to produce and being able to make the food reach the people and have people access and afford it and consume it, can we do that consistently? So I'm really trying to figure out ways to untangle some of those dynamics by thinking about policy and making sure policy changes really help alleviate the problem, but also community efforts. Can we do things that are from the ground up to make things a little more sustainable? So nice to have you.
Ambrish, we'd love to hear from your perspective because you're coming from a potentially very different discipline around climate change. And just let us know how you feel your work intersects with the discussion this evening.
Absolutely.
Hello, everyone, and thanks for the invitation to be on this panel. It's an absolute honor. My name is Ambarish Karmalkar. I'm a physical climate scientist. So, the main question that I try to answer is how does global warming affect us locally? To give you an example, what I'm working on right now, one of the projects is to understand temperature changes here in New England and how they're connected to local as well as remote changes that are happening in the climate system. So, the temperature change that is happening now, is it related to changes in moisture? Is it related to changes in cloud cover? Or there's something happening to our atmosphere and ocean systems in faraway places that is affecting our local climate? So, the way I do that is I use a combination of actual observations and numerical models, climate models, to be able to understand what are some of the physical processes that are operating at local scales. And that's really useful information for policymakers and to make decisions, right? So a lot of my work over the years have transitioned from just working on physical science to understanding how that information can be made accessible to people who want to use it. And that's where this question of equity really comes into play because um, about 10, 15 years ago, the climate communication approach was very top down. As a climate scientist, I would produce climate data, climate projections, and hand over those projections to people who want to use them. But very quickly, we realized that there is a mismatch between what they actually want and what we are giving them. Over the years, it's all about having that two-way dialogue between what's really needed at the local scale. How can we produce information that the communities can use to make decisions? And so that's been the focus of my research.
Great, wonderful, thank you. So, we brought up food insecurity, um, which is an issue for millions of Americans and is potentially going to become an even bigger issue come if this government shutdown continues with SNAP benefits ending. Here in Rhode Island, 1 in 4 citizens are food insecure. I think that is probably about the same for national averages. Um, Roger, I'd love to start with you and maybe move on with Ambarsh if you two would like to have a conversation with each other. And Christine, please jump in. How does climate change exacerbate food insecurity? I mean, we produce enough food to feed people in this country and around the world, but we also waste food. And how is that related to climate change? And then, of course, how is this all related to public health? So I think this is one where you guys are just going to have a conversation amongst yourselves. So maybe, Roger, if you'd like to kick it off.
Yeah, happy to. Well, I think climate change is, well, from a public health perspective, climate change is a public health problem, and food insecurity also. It leads to so many different uh, uh, outcomes that if we were able to approach it and prevent the impacts from happening in the first place, we wouldn't have the disparities we see today in health conditions, but also the impacts on the planet. I think from a food insecurity perspective, when we have extreme weather conditions, for example, that affects food availability. That affects food produce, and if we have less supply to distribute in the population, it means that we'll have increased food prices. It may mean that we have to find new ways to produce food to feed, like you said, so many of the humans that need a nutritional diet for meeting needs. And so I think that um, climate change and food insecurity are one to one, and we need to find ways to prevent both from impacting the planet and the people.
And Ambarsh, I think there's an interesting connection here of, like you said, about 10, 15 years ago, you were just giving people data and sort of walking away. Can you talk about maybe what changed? Was there a moment in which you were, and was it related at all to food, or maybe how did this sort of shift come for you? And then beyond that, sort of this really important discussion around climate and food.
Yeah, I mean, it's really important to think about what information we're going to need to be able to understand the impacts of climate change. We all know that agricultural systems of food production is affected by extreme weather changes in precipitation patterns, frequency, intensity, all of that affects food production. But we also have to realize that for centuries, farmers, the agricultural community, had figured out how to deal with that variability in weather, right? I mean, if I were to take you back a few thousand years, right, the first agricultural revolution started about 10,000 years ago, and since then we've had this agricultural system where farmers had figured out how to deal with weather variability. What is happening right now essentially is that because of human induced climate change, we have gone beyond that envelope of weather variability. And so that leads to these cascading impacts in all our systems, from the production of food, it impacts health of people who are working on our farms. It disrupts the supply chain completely, and then it affects how we distribute that food. And so, I think thinking about climate change and food it's a complicated issue, and we need to be looking at all of these different factors to figure out what the best solutions are.
So let's throw another complicating factor in: public health.
Yeah.
So I'd love, Christine, for you to jump in. What have been your thoughts? Have you been sitting here?
Yeah. To piggyback on my fellow panelists, when you have these extreme weather events, they can influence, crop yield. Coming from the south, this can lead to issues in terms of supply and demand. So lower crop yield means, more demand, higher prices for our food, and then we feel it in the grocery store. And as Roger mentioned, you have some communities that are already having trouble, affording food, and this just adds to it in terms of climate change. So accessibility, affordability of food, also water as well. So you have, these storms that lead to disruptions in terms of sanitation and hygiene. So we see an increase in like GI illnesses, skin illnesses, even eye problems as well. And then you have kind of an unclean water source, which then, impacts, our farmers in terms of, irrigation for their crops. So just like you mentioned, like a cascade of impacts here where you're not only impacting food, but you're impacting the water supply as well.
Any other thoughts as we come out of this question, Roger? Anything that's coming up or Ambersh? I think we've got that one covered. Well, at least for these 5 minutes. Yeah.
I'm actually going to do something brief because I think, speaking about public health and, you mentioned the farmers, and I feel like oftentimes, and we're going to talk about power dynamics, I think, in a little bit, but when we think about the food systems, I feel like the power dynamics are imbalanced, and there is too much power concentrated in some actors, but not others. And I feel like the people who tend to be disempowered in the system are farmers, are the consumers, and there's so many other people.
Farm workers.
Right, farm workers that, often are navigating this system and are at the end of the health impacts from this process. So I think the systemic lens, the systems lens to this issue is quite important.
Yeah, I think it's interesting when you think about the systems change, but then also just connecting all of these dots together and sort of seeing where we can get. We're talking about sort of power and where power resides. I think it is interesting, right now we have recent moves by our federal government that can make it feel like not much can be done, or that more food insecurity is inevitable with climate change and the things that are happening. But Christine, when we spoke earlier, you really wanted to highlight for students that there is a role that they can play in meeting this challenge. And I'd love for you to elaborate on this. Is we are talking about the problem, but what are the solutions?
Yes. I wanted to emphasize, and it's good to see some students here in the room. I teach in our public health program, and students are often wondering, is there a future for me in terms of a career in public health as they're watching what's going on? And my answer, of course, is yes. We need you. We need you now, and we will need you in the future because we'll need to kind of rebuild the systems and the structures, or not even rebuild, maybe innovate and think about new ways that we can address these challenges. So the skills that you're developing now, the networks, your creativity, it's going to be needed as we eventually we'll get out of this, and we'll need. There's a lot of work that's going to be done, and you all are going to be the leaders. So I just want to encourage everyone. Public health is still important.
Well, I think at URI, we certainly see this. I mean, I see the students sort of engaged in sustainability efforts on campus, composting on campus. A lot of things that I see happening sometimes are coming from the bottom up as opposed to the top down. And Roger, you spoke really well during our meeting about meeting power with power. Can you talk more about what you mean by that?
Yeah, absolutely. I don't have enough time to unpack it, but I do. I did mean that currently there's power being wielded in ways that make forces against equity in our society and population. So it's clear that we don't have the support from governmental actors to advance issues like food security or public health. So we really need to think about organizing amongst people who have a shared vision and a shared goal, and trying to use that as our strength and our power to address problems. I read a really interesting piece by Dr. McCarthy. I think Dr. Porter and Dr. Ornelas was also co-authoring this piece. A lot of health equity leaders writing about using community organizing frameworks that could be used to sort of build together efforts that allow us to make change and challenge some of those forces that are acting against our progress towards equity and justice.
I mean, I think it's interesting. I'll take a minute that I think journalism also plays a role in this. So I was recently at a very large journalism conference called ONA, Online News Association, and happened to meet a person who was working at the St. Louis Defender, which is this pretty amazing news organization. And they realized that they were losing a supermarket. They were losing their one supermarket in sort of this one neighborhood in St. Louis. And the news organization took it upon themselves to reach out to Black farmers in the sort of neighboring agricultural area and said, we need to do something about this. And the farmers are like, yeah, we need to do something about this. Now, this is a news organization doing community action. And what ended up is that the Black farmers started bringing in food for free. This wasn't something you needed to buy, to make sure that people in this neighborhood continued to have access, importantly, to fruits and vegetables. I mean, bodegas and small and convenience stores, gas stations, those all have, I'm going to put it in quotes, they have food in them. Convenience stores have food. And it's maybe sustenance, but it isn't necessarily nutritious. It may not also be the food that I'd love for us to talk about, may not be the food that you grew up with or that you engage with from a cultural standpoint. And I'm wondering if you guys can talk about the importance of food, not just to sustain us nutritionally, but how it sustains us also in our culture. I don't know, Christine, if you want to start, or
You want to get me out? Yeah, happy to. Well, I mean, it's in the food security definition. I think at least domestically, we have looked at food security from a food sufficiency standpoint. Is do we have enough foods to eat? But the definition is having enough foods to eat in quantity and quality to meet nutritional needs, and in personally and socially and culturally acceptable ways. And so, it's not, especially when we're trying to adhere to dietary guidelines, promote healthy diets. I think we need to think about what people enjoy eating, what is aligned with their values and their preferences. And it's not just giving people enough food. So yeah, from the definition standpoint, we're missing the mark already. So I do think we need to start there.
Christine,
Yeah, to follow that up. Earlier I was talking about interventions, and one of the interventions I was involved in with a community partner was this food voucher system, where they would provide vouchers to a particular grocery store that the community partner had partnered with this grocery store. And they realized very quickly that the vouchers weren't being utilized. And this was a Latino community. And what they found out was that, yes, we have these vouchers, but this isn't really the food that we want to cook with, that we want to eat. This is not our food. And so I think the lesson that we learned is it's not only access, but it's also knowing, and again, back to the idea of equity, like knowing really what your community and the group that you're working with, what they need. In this case, we've seen across the country really successful food voucher programs, but in this instance, we came across some roadblocks. So we were able to partner with much more friendlier and much grocers that were a little bit more familiar to our community, and we were able to make those adjustments. So,
yeah, I think that's a really great example of what can happen when you think you're doing something really good. Food vouchers are great, but if they don't meet the needs and the desires, it's not just calories.
Right.
It's also what is culturally relevant for you. I'd love to move on because we have about 10 minutes left. I'd like for you guys to talk about your skip time, and if you could describe your experience in the fellowship and how you may be different now than when you started the program. And Roger, I might start with you. I keep starting with you, but then you guys can follow on. So Roger, I'd love for you to talk about what's different now.
Yeah. It So the context. So I was a Skip Fellow this year. So I started the calendar year in Skip. It was the very first week of the year. It was 2 weeks before the current administration took office. And so I really came into the Skip experience hoping for something. Really was looking at it as a light of hope and to begin the year because Skip happened literally the second week of the calendar year. Um, I think I told you, Farah, I felt like I could actually take my mask off. I could actually stand and be with people and not hide behind my credentials or my CV or my work and actually be with other humans who also have very deep personal stories that they're willing to share with you. And I think that was the Skip effect. It was because Skip did all of that to enable us to be in community with one another. I felt really empowered. I was very disappointed that the funding got cut, but I've only gained as a member of Skip, and I truly appreciate the opportunity.
Bruce, what was the skip effect?
Yeah.
I may keep using that one. The skip
Well,
effect.
I
Skip effect.
guess Sunshine can tell us if you've succeeded. But I'll echo what Roger said. Absolutely, it's been a wonderful experience. I was part of the SKIP cohort last year, focused on climate change and water, and it's been a wonderful experience. A couple of things I learned through that experience. One was the importance of telling a good story. Even if you're talking about your science, how do you tell a good story? As scientists, we have this tendency to talk about all the gory details of our experimental design, all the findings and everything, but that doesn't really help when you're trying to communicate your science effectively. And so, one thing I learned last year was to ask myself this question: why am I doing this? What is the purpose of this science communication that I'm trying to do? Is it to inform people? Is it to inspire people? Is it to change people's opinions? And then craft a story that would address that particular question. So I don't think I've perfected that yet, but that's what I'm hoping to continue doing.
Could I add a couple of nerdy things because I could see so many things, but you reminded me of this. Is that this is also an evidence based training program. I mean, the rigor that went into this was noticeable. So I want to highlight that as much as I think it was an experience that, probably didn't require us to engage, with the level of detail that we tend to do it in our scientific spaces. The training behind it and the resources behind it really were driven and informed by evidence. And the second thing is arts-based education. We did so many things related to theater and playing games, and it really it was amazing. I just got to say that it was a very effective and evidence based program.
Christine.
Evidence-based intervention. Pretty good. Pretty good. Um, so impacted me in two ways. Personally, another community. So I have now I tower and I have my community of scholars, and then I do a lot of community engagement. So I work with groups outside of a university setting. But I've met a lot of really cool people here at URI and Michigan State and the fellowship fellows. So it's just been a great experience being able to connect with people from different disciplines that are tackling the same problem. Professionally, we're always thinking in public health about how do we translate our findings into action. And, I have, we know we're supposed to do it, but we don't really know how. And we learned multiple approaches through SCIP. And so I thought that was really cool and beneficial as well.
Great. So we're going to turn to questions in just a second, but this is the lightning round. If there's one thing, an action, an idea, or an inspiration, a story, you would want people to leave this discussion knowing, what would it be? Ambrish?
We didn't really touch upon food waste, so I'm just going to say don't waste food. If we are, if you talk about like we usually, all of us know about the 3 R's of sustainability: reduce, reuse, recycle. And there's a lot of emphasis on recycle, but I think the emphasis should be on reduce. Emphasis should be on overconsumption. It's not a popular thing to talk about, but it should really be on overconsumption. So that's what I'll say.
Roger?
Yeah. Oh, that's really hard. That's the hardest question. Um, uh, I'm gonna go with this one word: humanity. I feel like uh, we are in real time becoming less and less uh, human resource, and I do value the potential of artificial intelligence in our, in all the things that we do. So I think just making sure that we remain human above all, because that's really what connects us all. Um, to me, it's more about the framing than about the methods or the issues. I think the dean spoke on. We already solved other things that could be solved in silos. So I really think we need to come together and find our common ground. So I'll say, just be as human as you can be.
And Christine?
Okay, so I was thinking opportunity, right? So we talk about climate change. It's a big public health challenge, just like food insecurity is a public health challenge. But I also, piggybacking on the question about students and trainees, this is an opportunity. And so this is an opportunity for us to be innovative, to think outside the box, and think about ways that we can challenge these systemic issues. So yes, this is a challenge, but this is also an opportunity.
So don't waste food, be human, and don't waste opportunities. Sorry. We are going to open it up to questions. Mel will be coming around with the mic. So if you guys have any questions, we have a few minutes.
Questions. Don't be shy. Hi, please.
What might be? I thought it was turned on.
Yeah. I'm just such a soft speaker that it didn't even. Hi, my name is Colleen Cronin. I'm a reporter at EcoRI News. We're a local news organization that covers climate. I was a Metcalf fellow actually 2 summers ago, so cool to see the scientist counterparts. And so I learned a lot in the kind of opposite way. I'm just kind of wondering, you talked about wanting to try to connect people to good quality food. Like, people have access to food, but good quality. And to do that, we need, more maybe local farmers or to make local farming a sustainable thing. And I think the issue that I see here in Rhode Island talking to a lot of farmers is it's really hard. I mean, it's hard to do it at any scale, but it's especially hard to do it at a small scale, hard to do it when, farmland is really expensive, when the cost of different things is going up. I don't know, what do you think are solutions there? It's not an easy answer, but I think silvopasture seems to be something that's really helping small farmers out. But what other things, other programs are helping connect, the good food to the folks in a way that still works for the producer of the food?
Yeah, I mean that's a great. I mean, off the top of my head, I don't want to hear Amber and Christine, but I have to say, but I think it's policy change. I actually was a part of a program that it was called the Local Food Procurement Agreement from USDA, which now it's not. It's terminated or reformulated to something else, but it was intentional to provide funds for small-scale, social disadvantaged farmers to produce foods that are actually nutritious, predominantly produce foods, to be distributed for free for individuals who were food insecure. We are currently doing some of the evaluation, from the project we conducted locally, but it was an opportunity to add a market opportunity for the farmers because they would get, compensation for growing foods that would feed community members who are struggling with access to foods. And so, that's just one example, but I do think that it's just too much in the hands of farm workers to have the responsibility to feed a community or to feed people if it's not gonna have the return that would also sustain their whole life. So I feel like we need to figure. I mean, they're the most important actor in the chain, and again, going back to power, the power is concentrated in mostly government, the food industry, in the food system, I would say. But open to hearing what you have.
Yeah, I mean, I would add one thing. The climate piece is only a very minor piece of that puzzle, right? But the climate science community and climate modeling community is trying to figure out how we can produce that local scale information. So one example of that is maple syrup production in the region. And it's so sensitive to very small changes in temperature that working that out is really tricky. Maple syrup, I think the sugar content as well as the sap flow is highly sensitive to temperature. It requires freezing nights for that sugar to crystallize and sap to rise, and then it needs thawing temperatures during the day for it to flow out. And so we don't get those temperatures every shoulder season, and so those communities are really hurting. And then they try and ask us climate scientists if we could provide that information of how those freeze-thaw cycles are going to change in the future, and that's a challenge, but it's one piece of the puzzle that we can help with.
Hi, I'm Meg Simeone from the College of Health Sciences. I'm new faculty here at URI, so this is so wonderful, so thank you so much. Thinking about the last question, your responses to it, and just the topic in general, it's hard for me not to think about policy, infrastructure, subsidies. So first I was just going to ask, what are your thoughts on that? I know, a big question, but given the last question, what are other solutions that you see have promise? And it was Dr. Figueroa talking about his project that he's doing some evaluation on that I wanted to add in that positive spin. Thank you.
Yeah, I want to follow up on Roger. policies that incentivize the power brokers to um, play nice with others. So an example in terms of like grocers, I know several cities have passed these ordinances where if you want to build a grocery store in our city, in this neighborhood, well, then you have to also build one in one of our low resource communities. And they provide incentives to kind of improve the access to healthy food. So I think thinking more about policies that can kind of, dangle a carrot to make our food systems a little bit more equitable, that is something that um, one way we can approach this challenge.
Another example that comes to mind, I don't know if y'all have heard of the Public Health Collaborative, Northeast Public Health Collaborative. Essentially, when a lot of the disinvestments and negative decisions were being made at the federal level around vaccine mandates and recommendations and that sort of thing. So some states have identified leaders that have come together and are developing their own guidance and guidelines for at least some public health issues. I think one of them being vaccinations. So there's some Northeast Public Health Collaborative that actually Rhode Island is a part of, with I think other New England states and maybe
There's one on the West Coast.
there's one in the West Coast. So
In the South.
I think again going back to building power within structures where you have a shared vision and interest might be a way to kind of get around in the current climate, at least so far.
So, hi, y'all. Michelle Fons. I'm in the Community Equity and Diversity Office. Thank you all for being here. One of the things that I'm thinking about is you all are doing fantastic research and you're bringing it here and we're talking about these things. So, that's the first win. I've been on a journey of, professionally and personally learning about being better for myself. Healthy with eating, things like that, right? So as a consumer, I'm learning things that are super disturbing that I think we have an ignorance to. We enjoy food and we go out, we eat them and we have fun and it's social and it's cultural. And then when you really start to learn, if you want to, right? That's the other part. Some of us don't even, we're just rolling through life. I'm starting to learn about some of the ingredients that are in some of the things that I enjoy and learning about that ingredient and how much it's in things, but then we can get those same things, ketchup, mustard, relish, for instance, simple things like that that have so much bad stuff in it if you get it from one place, but if you go to Whole Foods, it's another, right? And so what it's making me feel like in my job that I do here, and we're trying to educate, create programs around education, students that I'm talking to have no idea, unless they're in science and nutrition, they don't know the harm. And I didn't for a long time. When I think about what I've been eating over the years, especially when I was in my 20s and I was hitting McDonald's on the fly, I didn't realize. And to this day, there are people in my life, even people my age, right? Not even just students, that don't recognize, right? So you all are talking about nutritional food. I'm thinking about in the community, what can I control? Because policy, research dollars, those are things right now that I don't know where they're going. And so it makes me feel a little hopeless sometimes.
Yeah.
Where I can find the hope is what I can control, right? So I'm really thinking about ways to think about the two of you that I just met today, and I hear what you're doing, and how can you be talking in workshops and sessions? I want to do that too for our students here at the university because I can control that. And I have center directors and folks that are, diversity officers. We should be empowering people with the knowledge they don't have about the things that you're talking about. And so I appreciate meeting you. But my question is, are you all doing that, right? So you're coming out to do this speaking, and you're doing wonderful research and behind the scenes doing all the work you're doing. I'm really thinking about how we empowering locally our young folks, our community members, about what is sucralose that's in your food doing to you when you eat it every day. When you're having those sodas every day, what it's doing. And I think that there's a lot of ignorance around it because I'm learning now some things that I didn't really recognize. So I just wondered if you all are doing some of that work.
Yes. No, we realize, a lot of the communities I work in, they're not going to come to a public lecture. So we have to meet them where they are. So I work with a partner that is doing really good work in that they are not just addressing one issue like food insecurity or housing insecurity. They're addressing all of these what we call like the social determinants of health. And so recently they had a workshop for renters. About their legal protections, their issues with renting and bad landlords. This is an opportunity for us to come out and, we hand out our flyers that include information about food resources and healthy food. So the idea is that, we have these community members who are coming to learn about protections that are available to them as renters, but then it's also an opportunity for some health education about other issues as well. So we have to go out and meet people where they are and provide a resource to them. And so Skip has also helped with that as well because we're not only communicating with journalists and fellow scientists, but we're also thinking about our audience, and so we have to kind of craft and tailor our messages towards our communities as well.
Yeah, I'm just gonna do the textbook response, which is that we have dietary guidelines that are, released every 5 years, and they typically have the best available evidence on the things we should be consuming and not. We know from data that nobody, no matter the demographic, is meeting dietary guidelines. So truly, we're missing the mark. We need to figure out how do we get people to actually adhere to them. There have been efforts to make sure that those guidelines are more digestible to the population. So there's of course, it used to be the My Pyramid, now My Plate. There's actually a plate that is more climate friendly, known as the Eat Lancet plate. I think there's a new version actually that just came out, but it's just encouraging foods that are, consumption of foods that tend to be, have a less carbon footprint. And so they're out there, but are they reaching the people that need to know about it? I don't think so, but good question.
We're going to take one more question. I just was going to say I never liked home economics as a class, but I actually think that home ec could come back to like help people learn how to cook food instead of DoorDash. Right? Because it's just too easy to Ambersh's point of food waste. It is just too easy to get food, to get, let's say, calories and things that taste good and things that are created to taste good, things that are created to make us feel addicted to them, sugar, salt, etc. So I think it was a really great question. And we're going to go one last question, Mel. Yeah.
Hello, everyone. I'm Nikia Kwashi. I'm a professor in public health, and it's nice to see students here too, including one of mine. I have a question regarding more the health equity, which is, do you have any examples of communities that have been disenfranchised or currently disenfranchised that have worked from the ground up to improve their food access and food security? Because it's coming from the questions or comments earlier about the power dynamics that are in play and seem very intractable overall in terms of the distribution of food, quality food, access to food, piggybacking on easy access to DoorDash, but there's still a lot of inequity in who is using DoorDash as an example, right? So can you think of any examples that can be hopeful of communities that are disenfranchised who are trying to find the power to improve their food access and food security?
Yeah, that's a really great question. So I know of efforts broadly that are used to try to alleviate the problem as best one can. One that comes up to mind is emergency feeding efforts, emergency relief efforts. They're highly variable because it depends on the context. I don't know if you all know Chef Andre, who's done when there's disaster that emergency kind of has like a social kitchen almost, where he feeds people. I think he's done it all over the world actually. It's been a pretty sustainable program, but again with funding. And so that's one example that off the top of my head. But approaches like that, I've seen, local pantries at churches. They're pretty common. But again, are they really alleviating the real issue? That's still is unanswered because we're probably increasing access to foods in communities that often don't have access, but the quality of the foods are not necessarily there. And we also have an emergency food system in this country that, uh, again, talking about power dynamics, power tends to be concentrated in the larger food banks compared to the smaller food pantries, and so the distribution gets a little bit fragmented, if you will, in the process of doing that. And it varies from state to state, but yeah, I don't know that we have. I wish we had a successful intervention that we've identified to implement or scale, but those are examples I can think of.
Barsha, do you have anything you wanted to add?
Not really.
So I guess I'll add something. So a couple of things. This year, one of the great immersions that we did was going up to Sankofa in Providence to the West Elmwood housing development. So that is an amazing urban. It's not an urban farm. It's community members coming together to grow food together, and it's got built up and built up over time. It's more than a decade old now, but they have this amazing food market on Wednesday afternoons, where it's foods that I may not even recognize, but are very important to particularly the immigrant populations that live in West Providence. I do think that the food banking system in this country, there are some really interesting local ways that food banks have tried to make change. So, gosh, almost 10 years ago, I did a program when I was at the Wall Street Journal called Defy Hunger Together. And it really looked at Feeding America, which is the largest food bank. They run 200 food banks across the country. And those food banks, I think, are really interesting to look at because this is where all the extra food from the big companies come into. So if you go to a sort of, I would say, traditional food bank, if you never have been to one, you should probably go because it's a lot of carbohydrates with a lot of sugar in them. But there are really good food banks that have changed that model and have worked with local farmers. So I can think of the one in Minnesota. There's one in Coachella County in California. That the woman who, so we all think of Coachella County, right? Coachella, where there's this amazing music festival, has one of the highest rates of food instability and insecurity in this country because most of the people who live there are migrant farm workers. And they realized that the food bank there of Palm Springs realized that people weren't coming to their big, huge food bank, this big depository, this huge warehouse. So they took their food out to the people. And then they started giving food out at school. They started making sure the kids had food to take home in a backpack. So they gave backpacks to all the kids and filled them with food, particularly on Friday afternoons. Because for a lot of children in this country, the only way they eat is by going to school. And so Friday comes, what happens on Saturday and Sunday? No food. So I think that is an interesting place to look. Again, this work was done 10 years ago, but I would suspect that it was valuable and sustainable enough that it probably continues. So, yeah.
I wanted to add. So you asked this question, and immediately I put on my scientist hat, and I'm thinking like, are there any peer-reviewed interventions that I can cite? And then I thought about what's happening on the ground. And so my partner that does the renters program, it's a multi-pronged approach. So they work with the Atlanta Food Bank. There are community gardens. There are voucher programs. There's a food bus that comes through the neighborhoods and sells fruits and vegetables. And I think, they're not waiting for a peer-reviewed article, right? They're trying to, throw everything at the issue. And I probably would guess that the solution is probably, a multi-pronged solution.
I will say briefly, there's a lot of conversation around food as medicine. and you know, it's a cascade of interventions that sort of are aimed at increasing access to foods that are helpful, uh, help the prevention and management of chronic illness. So the evidence is still emerging, I will say, but it's one that has gained a lot of support and investment from multiple institutions. Um, the, it remains to be seen how we get to scale them and continue implementing them in equitable ways, but it is one of those that are currently being talked about a lot. So.
Great. Well, thank you so much for this wonderful conversation. Please give a round of applause for our and thank you all for coming this evening, and to the many people who are on the live stream this afternoon. So, and one last thank you to the amazing Metcalf team for helping to put this on. It doesn't really happen without like these 4 people right here. So, well, actually 6 people. Our students are here. Thank you so much.